Okay, so we'll get started. I'm Naoto Ueno. I'm actually broadcasting live from Houston, Texas. It is currently 7:04 a.m. in Houston time. So my talk today is about ABC of team oncology, and the subtitle is to provide the best care to our cancer patient based on team medicine and team science. Okay, so let me explain why I like this concept of team oncology ABC, which I will be explaining later on. One is that this is very helpful for the guidance of formulating a team in medicine or even in science. It's guidance to understand what are the skill sets needed for your successful career development in the current environment of team medicine and team science. And it helps to understand what are the issues that we may face when we are involved in team medicine, team science. I'm understanding that all the participants has excellent skill sets, but one thing is that, including myself, I have hard time to sometimes understand the entire concept of how team is formed in medical care. And part of it is that because we do not understand the nature of the issue that each of the professions faces. So hopefully that what I've been talking will help you to guide you to understand what team medicine and team science is about. So the objective and the agenda will define what team oncology is. We'll quickly go over 3 major skill sets needed for successful team oncology. These skill sets will be also reviewed at the leadership workshop in November. The 3 skill sets that we have to have, or you may have already, is communication, leadership, evidence-based medicine. And I will quickly go over the ABC of team oncology, and at the end, I will summarize the talk. So the definition of team oncology, there are 3 definitions. It has to be an interactive team. This is as nothing unusual if there is a healthcare providers or scientists, you will form a team and it needs to be interactive. What we do in our practice or research, it must be evidence-based medicine. So the practice and care needs to follow the EBM. The uniqueness of team oncology is not simply practicing in the care, but the reason why we work as a team is to create evidence to improve or to advance cancer practice and care. This is very important because simply understanding EBM is not sufficient for the high quality level of multidisciplinary care. So the goal of team oncology is to increase patient satisfaction. This definition of patient satisfaction varies significantly depending on each individual patient. The need is not always defined by the healthcare provider, but the need is commonly defined by the patients. Therefore, each profession, including doctor, nurses, pharmacists, not simply the 3 professions, but all other healthcare providers needs to try to pick what is the patient satisfaction for this particular patient, and then we need to formulate the best care for our patients. So team oncology could be defined in many different ways, but commonly when we talk about multidisciplinary care, we have a tendency to talk about physician subspecialties, such as in cancer care, medical oncology, surgical oncology, radiation oncology, pathologists, and radiologists. And then also sometimes it includes non-cancer specialists. But I think what I need for everybody to understand is that this team oncology definition is a very narrow definition, and the reality is that everybody is involved in the care. For example, there is a patient in the center, and cancer specialist, physician-based cancer specialist is only one part of it. There is supportive care which include palliative care, psycho-oncology, pharmacists, nurses, physical therapists, many other healthcare providers that could provide a variety of aspects of the care. And if there is a research involved, that would involve research nurses, data manager, social worker, caseworker, and also the hospital management team and the volunteer teams. These are all important elements of bringing a very successful team to the medicine. So let's talk about essentials of team oncology. As I mentioned before, there are three major elements that we need to understand. One is leadership, second is communication, and third is evidence-based medicine. These three elements is additionally needed to your expertise. We have to always ask as a healthcare provider, do we have these three skill sets to provide the best care? So what kind of leader are we talking about? And I'd like for you to understand that there are two types of leaders in healthcare. And this not only applies to the healthcare field, but it applies to all kind of healthcare, all kind of fields regardless of healthcare. One is a positional leadership, and second is individual leadership. Positional leadership is very easy to understand. Most of us expect that we provide the leadership when you take a position, such as becoming a chief or department chair or director of a certain program. Yes, these are very important to advance your career, to obtain a position so that you could spread your vision. However, leadership does not start by obtaining a position. Leadership starts at any time. Even if you do not have a position, we have to ask ourselves, are we executing leadership in our career? So what is individual leadership? Individual leaders actually, action is based on integrity and ethics. This means that we always try to do the right things. Do the right thing is an easy thing to say, but not very easy. In the context of many things happening in the front line of healthcare, sometimes because somebody said so, despite that you are doubting the person's act, we may actually not protest or try to speak up to say that I have a different opinion. The other aspect is action based on vision and mission. We always have to ask what is our vision? Vision meaning your dream. 5 years, 10 years down the road, what is your uniqueness? This is also going to be questioned at the workshop to ask yourself, what is your personal vision which drives your career? The other part is institutional vision and mission. We all belong to one of the organization, and the question remains, do you know your vision and mission of your organizations, and whether this vision and mission is truly aligned with your personal vision. A lot of time we do not think this aspect. Therefore, when your personal vision is not aligned with your institutional vision, we feel a lot of frustration, and this actually results in hindering your career advancement. At last, we need to become a catalytic leader, not just being a leader. Catalytic leader actually inspires the others, meaning that based on your vision or your ideas, people will say, aha, therefore we'd like to work with you. A good leader does not order other people. A good leader inspires the other. So let's ask ourselves, are we an individual leader, a catalytic leader that's really functioning based on vision and mission, and do we have a high integrity and ethics? These elements all have to be met, and sometimes it takes a lot of training to become a good individual leader. As I mentioned, I'd like for you to think about what is your personal vision and mission. But for example, for myself, I work at M.D.Anderson Cancer Center. M.D.Anderson's mission is to eliminate cancer in Texas through the United States and the world through an outstanding program that integrates patient care, research, and prevention, and through education. Our vision is to become a premier cancer center in the world based on the excellence of our people, our research-driven patient care, and our science. This mission and vision truly aligns with what I'm actually looking for. Therefore, I'm always excited to work at M.D.Anderson Cancer Center. So you may want to do this exercise. Do you know your mission and vision of your institution or your team that you belong? What is your mission and vision? Is it aligned with your institutional mission and vision? And this is the first step that you need to think if you want to have a successful career. So let's talk about communications. So there are two skills needed for good communications. Communication is not about speaking out loud and being opinionated. The first thing that you need to learn is a good active listening skills. Do you have the capability of listening to the others? That's very important. Simply listening to the other is not sufficient. Paraphrasing, asking questions, and also truly stating that you're for or against the opinion is very important. After listening well, you want to state your opinion in a constructive manner. A lot of people want to be aggressive and being opinionated sometimes, but that's not good. What we need is to be assertive but not to be aggressive. These two skill sets are very important because when you have a conflict in your healthcare situation, you need to first listen to the other and then to be assertive. These two skill sets is the most important element for conflict management. So why do I emphasize conflict management so much? Well, conflict management skill is a very important skill that you need to have. When I was not comfortable with dealing with conflict, I have a tendency in the past maybe avoiding conflict. And avoiding conflict does not result in resolution of the issues, or it does not advance what I like to see in my visions. So the reality is in team medicine or team science, there should be conflict. No conflict is in the team is something wrong. We should all have opinion, and somehow we have to have opinion. We have to obtain a consensus through discussion and debate. If you have some plan for your career development, you will have a conflict. The stronger the vision you have or stronger the dream that you want to achieve, you will be different from the other. Being different is not being to be segregated from the other, but trying to be unique. Being unique results in conflict, and therefore you have to listen to the other's opinion, and at the same time you have to be assertive with your vision. And this is one way of being successful in your career. As I mentioned in team medicine, we must achieve the best care based on evidence-based medicine. Therefore, discussion or debate happens. We do not want to be emotional, and to be successful with effective communication, this requires conflict management skills. So as you can see from the three examples, it is very important you have a conflict management skills, and this will be also addressed at the workshop in November. So TeamOncology ABC, this is a concept that will help you to understand where you stand as a healthcare provider. This concept was published in Nature Review Clinical Oncology 2010. You could actually do a PubMed search and put ABC in my name, and you will be able to pull this paper out. We will be also distributing the paper during the workshop. So ABC concept of effective multidisciplinary cancer care is described by this diagram. You have T-AIM, that which means active care, Team B, base support, Team C, community resource. In the center, there are patients. So we will now go into each of the definition of the teams. So as you can see, looking in these tables, there are three components on the left side. Component A, active care. Component B, base support. Component C, community support. A includes examples such as physician, pharmacist, laboratory technician, physical therapist, and nurses. Component B includes such as chaplain, clinical psychologist, music therapist, social worker, and nurses. And sometimes family member and friend are included. Component C, patient advocate, pharmaceutical industry, research scientist, epidemiologist, social worker, family member, and friend. So what are the characteristics of these three components? Well, A actually has a tendency to practice based on evidence-based medicine. We reach consensus on best approach to care when standard guidelines are not available. So therefore, a good communication provides where the patient stands in the map. It helps to understand where the patient has been walking and where it's going. A have a direct patient care component, and the goal is to solve the issue based on evidence-based medicine. However, as you know, in the reality of medicine, solving issues is not going to always increase the satisfaction of our care. What's very more important is base support, which means that you empower patients by giving them a sense of medical ownership or of the medical care. This means that you have to listen, and then by listening, rather than providing the solution, you're basically facilitating for them to understand what is going on, and this will actually help them to make their own decision. Component C does not really provide direct patient care or treatment. However, it provides the support of the infrastructure to facilitate the work of the component A and B. C has a responsibility of providing the best care based on providing the infrastructure. So I challenge you to whether you think all these profession is part of the healthcare, and the answer is yes. Many of us forget that C or B is not part of the healthcare, or sometimes it's a forgotten professions, and we take this as granted. However, the reality is that every component or every profession is very important to provide the best care. So there are common issues of ABC. One is that, do we really have the expertise? A lot of times that issues in team care or team medicine, the person is not expert. For some unknown reason, we do not, in the world of healthcare provider, there is only one license. Even if you're not an expert, you still could practice. But we all know that there are people who are very good and who are not very good. So the question remains that how are we going to deal with people who do not have the expertise, which involves extensive education, and people who are underperformer really needs to have some accountability. A lot of time, many of us do not understand what the other disciplines are practicing. For example, the doctors may know superficially what the nurses do, but we are not truly understanding the depths as well as how much they could expand their roles. All three ABC sometimes lack of communication. Therefore, this makes very difficult to communicate. We think as communication as sometimes capability that it's inherited, but that is not true. It is a skill set. Therefore, how we could communicate efficiently could be learned. Many professions lack leaderships, and this is another issue. This leadership, as I mentioned, is not talking about positional leadership, but we are talking about individual leadership. Having a catalytic leader, regardless of position, is a key element of success in team medicine or team science. There are unique issues on each component. So people who are involved in Team A, such as particularly like doctors or sometimes pharmacists, they are very skill-oriented, but they commonly lack active listening. This is a big problem because physicians have a tendency not to listen to the patients or sometimes not listen to the others. We have a tendency to try to solve the issues very quickly, and this results in miscommunications. Not all patients are looking for solving the problem. Simply listening may be the skill set that's simply listening to the patient is what we needed. Team B is sometimes forget that they could be a liaison between patient and Team A. And also supporting Team A is very important, but they lack medical knowledge. But one thing is that Team B has to be very careful is that they are not there to provide medical opinion because they should obtain medical knowledge, but providing a medical opinion to patient could be confusing, and this needs to be avoided. Unique issues in Team C is there are general lack of knowledge about what Team B does, lack of EVM practice. Sometimes the knowledge in Team C is fragmented. For example, pharmaceutical industry or patient advocates. They may know about breast cancer, but they don't know anything about the other cancers. This is particularly issues when they are in more of a responsible position for the community. More larger general idea of what cancer is about is very effective to provide the best of infrastructure. Team C has a responsibility being a citizen of an oncology community. So what I'd like for you to understand is that ABC describes or encompass the totality of the cancer care. For example, physician could be, or any profession could have 3 ratios. Sometimes you may be more have emphasis on A, and sometimes it's more emphasis on B. It's a mindset of you, of how you practice your medicine. For example, in the environment, a large hospital may have a different specialty, so you may not have to focus on B and C too much. But if you go to a smaller hospital, as a physician, as a nurse, as a pharmacist, you may have to do all 3 ABC components. If it's an early disease in cancer, you have to practice more A. If it's a lung cancer, it's small, you prefer to have surgery done appropriately. But if you have a terminal lung cancer, you simply cannot provide the care based on A. You have to listen to the patient and you have to support the patient. Therefore, component B becomes more important. So what we need to do is, as a person, what is the ratio that you're using at the current situation that you are, and how do you actually formulate this ABC ratio when you create a team in your healthcare environment? So let's at least at the end look at the relationship to a patient. So one thing is that I mentioned about ABC ratio, but the reality of the ABC ratio is inside of a patient. This means that a patient, we are not in the position to understand every aspect of this one patient. This means that what patient is thinking or what patient is looking for their care is something that we will never completely understand. So therefore, there are 2 aspects from this that we need to learn. As a healthcare provider, we need to reach out to a patient to try to understand what the need is. However, at the same time, if the patient is not empowered and patient is not in the position to try to speak, we will never understand. Therefore, what's important in practice is really empowering the patient so that patient will also participate in our care. So at last, we will talk about EVM. So EBM is to examine the best and the latest evidence that can be utilized with a consensus to determine the best individual care and treatment. So this means that our clinical knowledge must connect to the benefit of patient that he or she desires. So a lot of time evidence-based medicine, we focus on the p-value of the statistic. Statistical significance has no meaning to some of the patient. What's more important is what's for me and how can that be actually applied to the particular person care. So if you think about EBM, the goal is not to determine simply that is this evidence correct or not correct, but it's important to apply this evidence to a patient care. So therefore you could say that EBM practice is the ultimate individual personalized or individual personalized medicine that you could provide. In evidence, there are three types of evidence. There are correct and wrong evidence. Therefore, as a healthcare provider, you should provide the care that's correct. If it's wrong, you should not provide that care. If you cannot follow this, basically, you should resign from what you're doing. But the reality is that many of the evidence is in the gray zone, meaning that it's not clear whether it's correct or wrong. Therefore, we have to achieve consensus through EBM process. And this requires going back to communication and leadership skill. So the gray zone could be divided into three settings: high consensus, intermediate consensus, and low consensus. High consensus meaning that most of us agree despite that evidence may be a little bit weak. Therefore, this is agreeable practice. But the issue is when it's low consensus, what do you do? Well, these are something that we should not be practicing. There are some people who try to practice based on low consensus. If it's low consensus and if it is an important question, this needs to be provided as a clinical research or clinical trial. So three types of EBM practice comes from the healthcare provider. We have to either create an EBM or we have to be an examiner. Not everybody has to create EBM, but we have to have a critical eyes of what the evidence and to determine that if this is truly applicable in the reality of healthcare that we are providing. But what we don't want to be is a follower. Because somebody famous or somebody well-known or because your team leader or positional leader is saying that this is the best, you just don't want to say yes to that. Being a follower is very dangerous. But we all know that we have a tendency to become a follower and then not to think very hard what's the best for the patients. So the process of this is called Kaizen. As you know, Kaizen is a word created by Toyota company in 80s, and this concept is currently applied in the healthcare setting in the United States. The idea is to propose solution, develop research, perform research, and assess outcome and identify problems. This could be clinical trials, clinical research. It could be non-clinical research, such as that if there's an issue of waiting time, I try to understand how to improve the waiting time. And by conducting the improvement, whether improvement happens or not. So therefore, research is about quality improvement. Whether you could improve the care is very important. And this Kaizen process is very important to be applied to the care. So if you think about it, let's just simply focus on clinical research. Clinical research is the best. And why is that? A lot of time, clinical research is developed by the experts in the field. It does have a tendency to improve treatment in a given setting. If it is a clinical trial, it will require scientific review, meaning the IRB will be involved. If the IRB is functioning, it protects human subjects. There is a rigorous informed consent process. It needs to be monitored. Quality control is needed. And offers patients most promising treatment rather than treatment known to be optimal. So I'd like for you to think about this clinical research or clinical trial in your care. A lot of time people say, well, clinical trials, because is this a guinea pig? No. If you think about the process of clinical research and clinical trial, it is the ultimate form of clinical practice. So therefore, even with your routine practice, we need to make sure that we are keeping a high standard of our care based on the formula that's being used for clinical research or clinical trials. So EVM is the only common language that all the different healthcare providers could understand. Different disciplines have different educational background and different skill sets. But EVM process helps us to communicate more efficiently. What we do not want is an emotional-based medicine, but we want an evidence-based medicine practice with passion and compassion. So every patient has a right to expect. This is what we call patient rights at M.D.Anderson. And there are many different patient has a right to expect, such as good care, understandable information, participation decision, consideration of personal belief and values, prompt response to requests, privacy and confidentiality, patient safety commitment, assessment and management of pain, respect of medical power of attorney and other advance directly, and to be heard if problems and complaints of grievance arises. Why is this so important? Having a 3 skill set of communications, leadership, and EVM, and understanding the ABC concept provides for each of us to respect the rights of each patient. And the whole idea is to encourage partnership between the patient and the healthcare team. So this is my summary slide. I'd like for you to think about how can you become a catalytic leader. You don't order the people, but because of your fantastic vision, you inspire the other. Not just vision, but in your daily life, how do you inspire the other? Communication is very important. We talk about active listening and assertiveness. You want to be ready for dealing with any conflict. Conflict is not about fight, but to be successful in your career, you do need to learn how to manage conflict. Every step in healthcare is about Kaizen improvement, and this needs to be through EVM. The reality of team medicine, team science is a matrix organization. So I hope that TeamOncology ABC will provide you to understand how this could be formed. So matrix team with highly effective and high expertise should provide empowered patient care and research, and this will result in improved quality of life and effective treatment. And at last, this will result in high satisfaction of patient, but not only that, it provide you with a high satisfaction of healthcare provider, which is yourself. So I hope that this helps you to understand what is going on, and you may have many different questions. And I'll take some questions now, and if you want to type, please type. Or you could ask me a question by Twitter at TeamOncology, which is my Twitter ID. And if you want to be a friend with me at Facebook, it's Naoto T. Ueno. Please tell me by message that you are going to be attending a workshop, and this helps me accept friends. No message meaning no message I usually do not accept as a friend. So thank you very much for your attention.
Thank you very much, Dr. Ueno. Thanks to everyone for joining the webinar. So if you have a question for Dr. Ueno, please type into the chat box on the right.
I hope that, I know this talk is very abstract and really not concrete. It's more giving you a frame of trying to understand what team medicine is about. So anything that would help you to understand, please just speak up, and then I'll be happy to answer anything. Or you could also ask me whether, if you didn't understand, if I need to re-explain some of the items, I'll be happy to explain again. Yeah, so Tamura-san says that catalytic leadership is a key word today for me. Yes, catalytic leader is a very important keyword. A lot of people think that as you age or as you take a position, you could do what you want to do because you're in that position. But the reality is that people who are really good at advancing career or forming a team medicine, or people who are successful writing a paper, they don't have to order. They do very well because they're a good person and they just inspire other people. I mean, one of the examples is recently Dr. Yamanaka, who was awarded with a Nobel Prize, and he's a great person. Probably he has a great expertise in IPS, but he's inspired other people. So therefore, he doesn't have to ask too much. He will get something from other because he inspired others. So the Nobel Prize could be a little bit too big of an example, but if you could inspire others, you could get a lot out of it. And it's not easy. It's not easy even for myself. It takes a lot of practice. Anything else? Okay, so Dr. Chien, I may not be pronouncing the name correctly. I'm sorry if I'm mispronounced it now. So he's asking about, oh, great, I pronounced correct. Would you explain more about assertive in communication? Yes, so we're going to be doing this exercise during the workshop also, but so as I talk during my talk, when you communicate, the first thing is active listening. So meaning that you really going to say, yes, I do agree. Do you mean by this? Or you paraphrase what's going on. So, but the most important thing is that when you have an opinion, you want to say this in a constructive way, in a timely manner. Particularly people who are introvert have a tendency to say things at the real end of what everybody said. So you have so many things to say, so you end up saying things, and then you just kind of burst many things out. And that's really not a very effective communication style. So while you listen very actively, you want to, after you let everybody speak, then if you have opinion, you want to say this in a timely manner, in a short sentence, so that people understand what you're trying to say. And then you keep repeating this. So active listening, assertive speaking, active listening, and by repeating this, it becomes more interactive talk. So there's two things that people who are not assertive. One is that people who's not assertive usually don't say anything, so therefore we don't know what you're thinking, or you say so much by interrupting the other people, so therefore it's not assertive at all, and people will be annoyed about it. Or because you don't say anything, and when you have a chance to speak, you say too much. So it's a balance, and if you could understand that, you could be more assertive, and then your communication could be more effective. But we will do this practice during the workshop. Anything else? Okay. So the question is how to learn more about each team ABC. Yes. So obviously, I really summarized in a short period. So the best way to learn about each team, and I'm guessing that you're asking how to learn about each discipline, right? So one is really speak with different disciplines and try to find out what they're doing on a daily basis. And then because a lot of time we don't even ask what do you do and how do you spend your time, and you'll be surprised what these people do. Or the other way is find a project that you can work together. It doesn't have to be research. It could be something that you want to improve on a daily basis, like waiting time or safety management. And let the other person do if they say they're willing to do it. And you'll be surprised how much they could do. And this will help you to understand, gain knowledge of each discipline or each team, what they could do. A lot of time, particularly the physician, have a tendency not allowing or giving the responsibility to other discipline because of two reasons. One, because you don't know what they're doing, or you don't have a confidence. So really, I don't have a concrete suggestion, but first is to ask the other, and the second is really to learn other discipline through a project. Did I answer your questions? Or was the meaning a little bit different? Okay, anything else? Okay, ooh, wow. Now suddenly there's a lot of them coming. Would you mind, so Dr. Tokuda, is it Dr. or Ms. Tokuda or Dr. Tokuda, would you mind to give us example assertive attitude? Well, I just talked about it, so I hope the one that I talked will help you, but assertive attitude really depends on if you're introvert or extrovert. We're going to do Myers-Briggs, and then I hope that we'll go over this during the workshop. Dr. Kawaguchi, thank you for your great lecture. I'm Post Kawaguchi. How to attend a team as a basic researcher. Okay, so how to involve basic research, or how to be a team as a basic researcher? That's an excellent question. So basic researcher really has to attend some of the clinical conferences, and once again, by attending the clinical conferences, you'll gain some basic knowledge. But what's really important is that when you're doing your research, rather than focusing on just your topic, but you probably should ask this question to the clinicians: what is the clinical relevancy of my research? And finding a clinical partner really helps. This really applies for the clinical people like nurses and pharmacists and doctors, that if you have any question, find a basic research partner. What does this mean from the mechanistic point of view? And by doing this, this will help you to understand what's going on, and by repeating this, you could become a great member of a team. Okay, so Dr. Tamura is asking, what is the key to lead discussion to assertion and good relationship? what do you mean by what is a key to lead discussion to assertion and good relationship? You mean how do you lead the discussion to have an assertive discussion and active listening? So this is I'm guessing that how do you facilitate a good discussion? So I think one thing is to have a good discussion. What's really important is that there's a skill set called being a good facilitator. And being a good facilitator has to really make sure that you know the distribution of people who's in the meeting, and so that everybody have an equal opportunity what's going on. The tendency in the team, there are people who are willing to speak up regardless of the questions or the situation you're in. So those people will always speak up all the time. I think the most difficult part is the people who don't want to speak up. So therefore, you have to have some kind of formula to make sure that you give them a chance up front so that they could speak up, rather than letting the people who want to speak up first. The people who don't speak up comes first by facilitating this. The other thing is having an empathy on everybody. So if anybody says good things, or generally, it's very important that it's important to say that you ask good questions or thank you very much. Really appreciate that telling me the story. So having an empathetic process really helps you for people to speak up. So Dr. Sasaki says, I work with medical students at our hospital now. My question is, which is effective education for medical students? Do you think to participate in Team A, Team B, or Team C? That's all above. Like I say, we use the word team, but it is a mindset A, mindset B, and mindset C. So it is important to understand all aspects, and that's how you become more successful with your career. This not just apply for medical students, but nursing and everything. And it's important to give a talk about Team ABC. A lot of times when you explain ABC, people will say, this is a different way of looking, a medical field, and it helps me to understand what are my weaknesses in my medical practice. Ms. Weki, I would like to know conflict management skill for effective communication. Yes, so Ms. Weki or Dr. Weki, we're going to be doing this also during the workshop, and it's hard to really explain everything, but basically conflict management is the same thing about two communication skills, which is active listening and being assertive. So if you have a conflict, what do you do first? The answer is active listening, not being assertive. You want to listen to the other. You want to find out why this person is angry, why is this person is telling a different opinion, trying to understand what is behind the scene for this person to say this. And this is where all the effort should go in for a successful conflict. If you don't understand that, it is very difficult to overcome the conflict. So conflict management, first thing you could do is listen to the other. Don't say your opinion until you understand what the other is trying to say. And also, having an empathy is very important. If you say, well, I don't like you, or I don't agree with you up front, or I don't care, if you show that kind of attitude, it just makes the situation worse. Try to, have empathy. And listening to the other does not mean that you are agreeing with other people's opinion. You are simply trying to understand and recognize. And you could still have a different opinion. So after you have listened actively, then you could be assertive. Great. So I think it's about time. I hope this helps. I know that it's a very short time and I may not have answered all the questions. So I'm really willing to answer through Facebook or Twitter, whatever that works for you. If you want to send me email, it's nueno@mdanson.org. Happy to communicate, whatever that works out for best for you. But generally, that we like to really facilitate, and many of your good questions could be very helpful for the others. So I think Facebook is a very effective way of communicating. So if you don't mind, asking for a friend request, and as I said, please make sure that you have a message with you. So thank you for your time. I think most of you, it's time to go to bed, and good night, everybody. And my day is starting at Houston. So see you in November. Bye.
Thank you very much, Dr. Ueno. Again, thanks to everyone for joining this webinar. I look forward to seeing you all next month in Tokyo. This is the end of this webinar. Thank you very much. Bye-bye.